I am here with the mayor from San Juan, who was invited to come to testify before the House of Representatives today about what's happening in San Juan and all of Puerto Rico. Only the Republicans canceled the hearing at the last minute. So she was able to come by and see me, and we were able to talk just a little bit about what's going on right now in San Juan and all across the island and the two smaller islands. So let's start with...
And Virgin Islands.
The Virgin Islands.
It's even worse in Virgin Islands.
So how long have people been without power now in Puerto Rico?
Well, most people in the United States grew cognizant of the issue when Maria hit us.
Yes.
But there was Irma a week and a half before. So this would be the 57th day for many people. A lot of them in San Juan, but most of Puerto Rico.
So 57 days with no power. You know, the official death toll numbers were something that Donald Trump, President Trump, bragged and said, you know, this was
not a real disaster because Katrina had a lot of people that died.
So I sent a letter with some other senators about this, asking for a more accurate count. And now it appears that more than 900 people
have been cremated in 1 month.
Without any investigation into how they died?
It seems the official statement is that it has all the appropriate documentations, but this is what a lot of people believe is happening. Let's say I'm hooked to a respirator, I'm in my home. There's no energy, and so now I have a small generator. And the generator stops working because generators aren't made to work months at a time. And I died because I suffocated. So they're marking that, it seems, as a natural death. And indeed, it's a natural death, but it's related to you not having power or not having appropriate access to power. In fact, I know of a hospital in San Juan where 3 people died in intensive care because the power goes on and off. And even though you can have a battery-operated ventilator, it may last 6, 8, 12 hours, but it doesn't last 48 hours. So what is happening is that hospitals have had to push people from one place to another, and it becomes very, very risky for health considerations. So we have had a request in for weeks for FEMA to give us a sort of like a medical tent where we can put people that are not sick enough to be at the hospital, but that they need life support systems to be alive, so that we can keep them in a place and have doctors and medics watching over them, and we're still waiting. But as you go outside of San Juan, the situation becomes even worse. People are still drinking off of creeks. Leptospirosis, we've had confirmed deaths of leptospirosis, which of course happened when
This is from drinking dirty water.
Yeah, where actually animals are using it because they're dying or they're drinking from the same water source. Human scabies is in epidemic proportions, conjunctivitis and gastritis. So we are in a humanitarian crisis, and we have to do everything we can to stop before we hit a health crisis.
So that's what we need to fight for. There needs to be enough money going to Puerto Rico. The money needs to go to the towns and to the people.
And to the central government, not just to the central government, but
to the towns and the people as well. And make sure that it is not going to the Wall Street funds. This is really important.
I just watched TV yesterday for the first time in almost 2 months. But somebody sent me a little clip of your activity where you said, Mr. President, do your job. And really, that's all we're asking. That's all anyone can ask.
That's right.
Is for people to do the job and commit to the moral imperative of helping those.
That's right. And the job right now for this government in Washington is to make sure that we get the resources down to Puerto Rico, both for the emergency relief and for long-term cleanup and rebuild.
You've heard us and you haven't forgotten us.
We're not going to forget.
Thank you very much.